Hi everyone, it's Dr. Gina Joe, or Dr. Gina Jefferson, Professor of Otolaryngology, Head and Neck Surgery. So we're in the midst of residency applicant interview season, and one of the questions I've asked this year is for the applicant, please provide a perspective on diversity, equity, and inclusion in medicine and how that has evolved over time. Sadly, I report that many are unable to articulate or provide an understanding that a diverse workforce actually improves healthcare delivery and ultimately the health outcomes for our underrepresented segments of the population. While there has been increased focus, conversation, and activity in our medical schools by the Accreditation Council for Graduate Medical Education and our workplaces, my interview experience reminds me that just as medicine is a pursuit of lifelong self-directed learning, so true is cultural understanding, requiring similar efforts by both individuals and organizations. So I offer 3 tips of many for which we can all engage to improve diversity, equity, and inclusion in medicine. First, regular self-reflection is paramount for identifying our own unconscious biases. Awareness of our unintentional biases that color how we interact and communicate with our colleagues and our trainees, how we interact and communicate with our patients is critical for self-improvement. Self-reflection opens the door to communication and the potential to own our actions and to modify our behaviors and to let others know that we genuinely want to improve. Second, we must all own and live our roles of enacting inclusivity through collectively working toward a culturally sensitive learning place and workplace environment. Modeling and living respectful behavior that is sensitive to each individual with whom we interact, learning from one another what constitutes discriminatory behavior are means of advancing diversity, equity, and inclusion. Third, it is important to remember to connect our diversity, equity, and inclusion efforts to our patients. Obviously, the well-being of our learning place and workplace environment improves with successful diversity, equity, and inclusion efforts. But our ability to best communicate with our patients and establish the trust and rapport necessary for true patient-physician shared decision-making will lend itself toward achieving our equitable outcomes for our patients. Cultural sensitivity is key for professional healthcare well-being and is critical for equitable healthcare. If you find my tips helpful, share them with your friends and continue to follow me at Dr. Gina Joe on Instagram, YouTube, and Twitter.